Thank you so much to that panel. That was fantastic. So our next speaker is coming up right now. So I'll ask the panelists to clear the stage. So our next speaker is Anton Gunn, who's the Director of External Affairs for the U.S. Department of Health and Human Services, which is a critical component to the rollout of the Affordable Care Act. We invited Mr. Gunn here today because we know, as musicians and advocates, that health insurance is a critical issue for musicians, and through FMC's own surveys, we've discovered that musicians are chronically uninsured, as are many artists in the creative fields. We released a survey about 10 days ago, which was the result of a survey which we did in July and August, which was the third time we've surveyed musicians. But we expanded our survey pool to include all sorts of artists based in the US. And we found that 43% of respondents did not currently have health insurance. Of those who did have insurance, 39% were paying for a private individual plan, which is vastly more than the American public, most of whom rely on employer-based insurance. For those who weren't insured, 88% said it's because they can't afford it. And we know that there are many components of the Affordable Care Act are trying to tackle some of these fundamental issues about affordability and access to insurance. And so we're so pleased to have Mr. Gunn here to speak about health insurance and artists. Thank you.
Thank you very much for that wonderful introduction. It's a pleasure for me to be here at this event today. As you can imagine, we have lots of stuff happening right now at the department, but I'm happy to take a few minutes of my time away to be here, a part of this, for several reasons. One is that I'm incredibly passionate about access to affordable health coverage for all Americans and the work that we do at the Department of Health and Human Services. But I have a personal interest as it relates to health care and as it relates to artists, particularly in the music industry. In order to explain how that makes sense, I'm going to tell you a little bit about who I am, because I think it's important to have context of who people are when they speak to you, because it actually helps to inform perspective that they come from. I'm originally from Hampton Roads, Virginia. I grew up in Virginia Beach, Virginia. That is my hometown, where my father was raised, my mother was raised. My grandparents met there and got married in the shipyard in the 1940s. As a part of growing up in Hampton Roads, I was fortunate enough at a very young age to become engaged and married to a culture and a music that began in the 1970s and really came to the prime spot of life when I was an adolescent, and that is hip-hop. I am hip-hop. That's how I introduce myself to most audiences. Hip-hop is who I am. Healthcare is what I do, is how I like to say. And there's a particular connection with hip-hop in the area that I grew up in Virginia Beach. I went to high school with one half of the Neptunes. Chad Hugo went to high school with me. That work of hip-hop started when Teddy Riley left New York City and came to Virginia Beach and built a studio, and everybody that I knew was engaged in the music culture in some way, shape, or form. So whether it's Eclipse, whether it's Neptunes, whether it's Timberland Magoo, and I went to middle school with Magoo at Deep Creek Junior High School, I was around the industry a lot. I knew lots of people who were aspiring DJs and rappers and beat makers and everything else, and I too dabbled in that culture. Yes, I've spent my money on studio time trying to get my demo together, because I was going to mail it off to every record company in New York City, and I was going to get a deal, and me and my friend were going to make it big in the rap industry. But something else happened to me during that same time, is that I grew 5 inches in the summer and became 6'5" and 225 pounds and could catch a football and run like a deer. So I got a full scholarship and went to the University of South Carolina to play football. And that fundamentally changed the direction of my professional life. But what never escaped me, what never got away from me, were my friends, my colleagues and my cohort and my love for hip-hop music and the culture around that. So I come at this from a very passionate place of knowing friends who, for years, traveled around the Southeast, traveled around the East Coast, went to the West Coast, trying to get that big start of theirs, trying to get that big break, performing and opening at a concert that's supposed to have 10,000 people in it, but the lights are still on and there's still daylight outside, and they're performing in front of 200 that hadn't gotten there yet because they're the pre-show. So I know somewhat about the artist world and what artists deal with in terms of trying to passionately build their career in a way that gives them the opportunity to fulfill their goals and dreams, to make creative, culturally significant, musically significant, and at the end, financially significant, hopefully, for some artists, the music that they believe in and that they love. But I also know the struggles of being an artist and going through that process. I can't tell you the number of friends who I've had that may have suffered from some level of pre-existing condition, whether they were born with an illness or a disease that many times kept them from being able to fully create at the highest level in their mind and their body and their spirit because they were not healthy. I've had friends that have come across injuries as it relates to being engaged in the music industry. Late night studio hours, fights over who gets to use what beat and who gets to go first on what verse. And then the after party after you have a successful show and something happens and somebody gets hurt. We never plan for bad things to happen, but sometimes bad things do happen. And when that happens, the people who suffer from it the greatest are the people that have no access to health insurance coverage. They can't get treatment for their pre-existing condition. They may avoid going to the doctor to get their throat looked at, even though they're a singer or they're an artist of some sort, because they don't have health insurance coverage. Or they can't afford to keep themselves healthy, whether it's routine screenings. Many of these things are absent from the lives of many artists because health insurance has been out of reach for them for a couple of reasons. One, because of affordability, and two, because they may have had a pre-existing condition or not have had a job that provided them health coverage as they pursued their goals and dreams. This has gone on for decades. Everyone in this room probably knows an artist who for decades has wanted health insurance coverage and couldn't afford coverage in the private market or wasn't involved in the union in order to be able to get health insurance coverage. And it's been a struggle and a difficulty for so many people. That is why I'm excited to be here to talk a little bit about the Affordable Care Act and the role that it can play to fundamentally transform the success of artists and being able to pursue their craft, their goals, and their dreams with the safety and security of knowing that if something bad happened, they're covered. If they need to get treatment, they're covered. If they need to address that pre-existing condition, they're covered. I cannot underscore and stress how I believe that health insurance coverage can have a fundamental difference in the quality and the amount of good artistic, cultural music that can be given to our society when we have strong, healthy artists. I want to talk about three artists in particular who their stories, in particular for me, just speak loudly to what it means to not have coverage. The first is a hip-hop artist, an MC named Poetic, who was a part of a group called Gravediggers, where the RZA was involved with, RZA from Wu-Tang Clan, who died of a massive heart attack at a very young age. Whether he had health insurance coverage, who knows? But to lose people at a young age is a challenge to all of us. Then you have another artist. Many people know this artist, Phife Dawg, a member of a tribe called Quest, a multi-million-dollar record-producing group who traveled around the world, and Phife missed plenty of studio time because he suffered from type 1 diabetes and wasn't always on treatment that he needed. And being a diabetic, you can't be without treatment. Phife recently had a kidney transplant and is now doing a lot better and in a lot good health, but without having access to health insurance coverage, that could have cost him his life, most definitely cost him productivity in his music career. And the last one, and the one that is most profound to me, is that there are very few what I like to call Pinnacle hip-hop music producers. Everybody knows Dr. Dre, everybody knows DJ Premier, everybody knows Pharrell and many others, but Jay Dilla is one of the greatest of all time, whose life was cut short because he lost his battle with lupus by going into cardiac arrest. that shows, and anybody that knows Jay Dilla's music and knows his music collection and the artists that he's produced for and the things that he's done, know that that is a great loss to music and the music industry not having him with us. That speaks volumes to the importance of having health insurance coverage and being able to get treatment when you need it, to be able to manage chronic conditions when you need it. I have a coworker who suffers from lupus and had a conversation earlier today, and my coworker said, I could not imagine living without health insurance coverage. That just speaks clearly to us why this is important. So now to get to the summary, that the Affordable Care Act primarily, I don't know what you've heard, not even going to try to measure my words about what you heard, but I'll just tell you, speak realistically about what the Affordable Care Act is. The Affordable Care Act does so many things as it relates to health coverage. In the early years, the Affordable Care Act began to put new rules in place around how insurance operated for people that had coverage. It basically said to insurance companies that you can no longer violate a rule that is in place called the 80-20 rule. And the 80-20 rule says that if you pay for health insurance coverage, so right now if you have coverage, if you spend money on health insurance coverage, that 80% of every dollar that you pay on health insurance coverage should come back to you in coverage and the quality of services that you receive from your health insurance product. And only 20% is allowed to be spent on what's considered overhead costs. So that's marketing, executive compensation, any other administrative costs. 80% has to go to care, and 20% is allowed to be spent in overhead costs. And if any insurance plan violates that 80-20 rule, which is if they spend more than 20% on overhead costs, they have to rebate that amount that they overspent back to consumers in a form of a check. They have to send a check, or they can provide better services. And so in 2012, $1.1 billion went back into the American economy from insurance companies who violated the 80-20 rule. In 2013, it was about $500 million that went back to consumers in savings. Why was it less? Because more insurance plans started to comply with the 80-20 rule, which is providing you a better quality of product and making the administrative costs at 20% or lower. So that was a big benefit for so many people. For seniors who are in the Medicare prescription drug program, they were receiving savings on their costs. If they were in the middle of their donut hole, saved an average of $700 in 2011 on their prescription drug costs because of the Affordable Care Act. So it put a lot of things in place early on. It said to children under the age of 26 that you can stay on your parents' health insurance plan and receive coverage that way. So we know 3 million young adults got health insurance coverage through that provision that would have otherwise not had it not been for the Affordable Care Act. These are all the things that the Affordable Care Act did early on. But the most important thing is what the Affordable Care Act is doing right now, which is saying to every American, no matter who you are, no matter where you live, that no insurance company in America can discriminate against you because you have pre-existing conditions. They can no longer charge you more for being a woman on a health insurance plan. So if you're one of the 43 million Americans or many others who have pre-existing conditions, reportedly have pre-existing conditions, that could have been used as an excuse to keep an insurance company from giving you a health insurance plan if you wanted to purchase one. They can't do that anymore. They cannot do that. Matter of fact, when applying for coverage under the Affordable Care Act through the insurance marketplace, they can't even ask you what your pre-existing conditions are. So you don't have to talk about your diabetes. You don't have to talk about your lupus. You don't have to talk about your high blood pressure or any of your pre-existing conditions that you may have. You're actually able to get coverage, okay? And let me talk about what this coverage is that all Americans now have access to. I'm not talking about what I had at one point in time in my life, which is what I call cut rate insurance, which is I had an insurance card in my pocket and thought I was covered, but every time I went to use it, it didn't cover anything that I needed it to cover. It didn't cover my wife's maternity when she was pregnant with my daughter in 2004. It didn't cover my prescription drug that I needed for my acid reflux. It didn't cover certain service, didn't cover her annual exam, my wife's annual exam. So I had an insurance card, and I was paying a pretty penny for it every single month, but it didn't cover anything that I needed it to cover. So I thought I was insured. Maybe I wasn't sure when I went into cardiac arrest, if I had a car accident or something majorly bad happened to me, I might have been covered. But for those essential health benefits that people use when they use their health insurance coverage, not all plans before had that in them. But now, thanks to the Affordable Care Act, any plan that a consumer rolls in 2014 must have those essential health benefits. It must cover outpatient services. So if you need outpatient surgery, it's covered. Hospitalization is covered. Maternity care is covered. Prescription drugs are covered. Rehabilitation services and habilitation services. These are all essential health benefits. And one essential health benefit that's really important that was many times not covered by other health insurance plans is access to mental health and substance abuse services, recovery services. So being able to get treatment for drug addiction, alcohol addiction, or even depression, simple things like depression, insurance plans now must cover that in 2014. That's an important part of the Affordable Care Act. It's an important part of all health insurance products going forward. And this will make a great difference to so many people's lives, particularly who are trying to expand and explore their own craft, that they know, again, if you're not healthy in your mind, if you're not healthy in your body, and to some degree, if you're not healthy in your spirit, can you really produce the quality of work that you want to produce in any field, but especially in music? That's an important piece of what the Affordable Care Act provides. And so I lastly want to share with everyone, I know don't want to skip over the 800-pound elephant in the room, and that is the challenges that we've had with our web portal, healthcare.gov, where you can go and get information about the marketplace and actually enroll in coverage. We have had some challenges, some glitches, and some problems with the website, but I'm here to tell you that the website is fixable. It will be fixed, and we have people who are working 24/7, 7 days a week to solve the challenges with the website. We have a tech team that's in place, a new leadership team in place who are managing how we improve the website so the user experience from a consumer standpoint is easy and significant for people to use, and we think it'll be working for most people by the end of November. But I don't want to dwell on the website, because dwelling on the website is like a music artist dwelling on how many of their records are going to be sold at Sam Goody's record store across town. That is not the only way that you get your music product out, is by relying on a record store. You as an artist do lots of other things to get the message out about your product, what you're providing in terms of musical connection for people. And we're doing the same thing at HHS. Healthcare.gov is not the only way that you can enroll in coverage. There are actually 4 ways that people are able to enroll in coverage, and the healthcare.gov web portal is one of them. A second way people can enroll in coverage is over the phone, that we actually have a 24-hour, 7-day-a-week call center that operates in 150 different languages. So you can call at 3 o'clock in the afternoon, or you can call at 3 o'clock in the morning when you finish your studio time and find out about how you can get enrolled in affordable health insurance coverage. And the wait time to answer that phone in that call center is less than a minute. It's about 90 seconds most times, so it's less than 2 minutes, about 90 seconds. But it's been a lot faster than that because we have a very robust call center and increased capacity on it to be able to help people to enroll in coverage over the phone. And what I like to tell any audience that I talk to is this phone number, to make sure that you save it in your phone, you write it in your notebook, you give it to your friends. If you're talking to somebody that you know that doesn't have affordable health insurance coverage, or maybe they don't even understand what health insurance is, and you don't want to sit there and explain it to them, we have a call center that has the robust capacity to do that. That phone number is 1-800-318-2596. I will repeat, 1-800-318-2596. 24 hours a day, 7 days a week, in 150 different languages. So if you happen to be a guitar artist from the Mississippi Delta, or maybe you from a lower portion of Louisiana between New Orleans and Lafayette, and you speak a special brand of Creole, there's somebody at that call center will be able to help you to understand what your health insurance options are and how you can enroll in coverage. That's the second way people can enroll in coverage. The third way that people can enroll in coverage is that you don't have to do it online or do it over the phone. You can actually do it in person. We have navigators and assistance personnel that are in the 50 states all across the country that are working on the ground to work face-to-face with people to help them to understand what their health insurance options are and help them to enroll in coverage. And we call these folks a wide variety of names. Some of them are navigators, some of them are at community health centers, and many community health centers are where I know a lot of artists went and got primary care. When they didn't have health insurance coverage, a community health center would charge them on a sliding fee scale. If they're able to need and get treatment, they could go right to a community health center. Well, we've empowered community health centers with resources to have trained people on staff that can help people to enroll in coverage. They know who the uninsured are, and the uninsured have been coming through their doors. They now are helping people on the ground to enroll in coverage. If you want to find out who the local help are in your zip code in the community in which you live, you can go to healthcare.gov. Actually, you can go to localhelp.healthcare.gov, and that's a local help tool that'll pull up. You can put in an address and a zip code, and it'll give you the names and the locations and the hours of the organizations right near you that can help people enroll in coverage face-to-face. So that's the third way. And then the fourth way is real simple. It's kind of old school, if you will, which is you can go to healthcare.gov and download the application, a PDF application, fill it out, and mail it in. That is the fourth way that people can enroll in coverage: by paper, in person, over the phone, and healthcare.gov. And I don't want to sit here and let everybody think that healthcare.gov is not working. The website is working. There are people who are getting through and enrolling in coverage, but it's not working as efficiently as we want it to, as the president said that it should be working, and so we're working around the clock to make sure that we get that done. So the big note is there are 4 ways to enroll in coverage. This can be a new day for many people who care about music, who care about musicians, who have them in their families, who are close to them, who've spent lots of time helping and supporting artists in their craft. One of my biggest mentors in my professional life is a musician. His name is Cy Khan. He's been a musician for a long time, and Cy and I have had lots of long conversations as he's aged about the importance of healthcare, and thank God he has some. So I know that this is an important thing to so many people across the country, but I think it can be particularly important and particularly impactful in the lives of musicians and the lives of artists of all types everywhere, to be able to have quality, affordable health insurance coverage that not only meets your needs, but the last thing I'll tell you about, that fits in your budget. Because affordability is a big, important piece for people to understand, that the Affordable Care Act also makes health care more affordable. One, it does that by creating competition in the marketplace. So when you go to healthcare.gov or over the phone, or once you fill out the paper application and you get information back, you will be selecting from health plans that are competing against other health plans for your business. This is where you have the bargaining power as a shopper to decide where you want to spend your money and how you want to spend your money. That's an important piece of the marketplace. And as a part of shopping, you also may qualify for financial assistance to help you to be able to afford insurance. These are called tax credits, advanced tax credits, to help people to pay for insurance. And you qualify for these tax credits based upon your income. And if you're like many of the artists that I know, before they get that record deal, they're making it show by show, which is they go from one town to one town, and what they perform that night is what they get paid. And many times it adds up to enough to just get you to the next town or get you to the next event, but doesn't add up enough to pay for health insurance for yourself or for your family. That is where the advanced premium tax credits come in. If your income as a single individual with no children is under $46,000 a year, you may qualify for subsidy to help you to pay for health insurance. If you have a family, if you're a family of 4, you can earn up to $95,000 a year and will qualify for subsidy to help you to afford health insurance. That is what the law provides, of those subsidies. And we are seeing how this works. There are 6 in 10 young adults. We did a study a few weeks ago that said 6 in 10 young adults may pay less than $100 a month for health insurance when you count their subsidy, okay? That's big. That's less than what people pay for their smartphone bill every single month. So this is what health insurance coverage can mean for so many people. And that's why I wanted to take some time to be here with you today, because I think the Affordable Care Act is a tremendous support to so many people and a tremendous opportunity for many musicians to be able to have their quality, affordable health insurance coverage that meets their needs and fits their budget, but gives them the opportunity to advance their dreams and goals of creating great cultural music for their audiences, for their fans, and those that they work with and support. And so the last thing I want to mention, if you're an artist in here who is uninsured, who's looking for the opportunity to have health insurance coverage, looking for the opportunity to get enrolled in coverage, we want to know your story at HHS. We're actually really trying to talk to people who want coverage, who are looking for coverage. Maybe you have a pre-existing condition, maybe you don't. Maybe you just want health insurance coverage and haven't been able to get it in the private market before. We want to be able to talk about that. So we have staff members here who are working to collect stories of individuals. We'd love to get you on tape or video, and there she is helping us out with that. I want to say thank you all for your time and your attention, and I'm happy to take a couple questions, but I don't want to prolong the hour too long. So with that, thank you.
Thank you for your presentation, and you have wonderful taste in music. I just
Thank
have
you.
to say that.
Thank you.
Rest in peace, Dilla. My just question, because I haven't been able to, I really haven't researched it truthfully,
Sure.
but I know that there's a penalty for failing to enroll, and I just wanted to know how that works. Is there a specific number? Where the information comes from?
That's a great question. So the law provides that all Americans are supposed to have health insurance coverage in 2014. So by 2014, everybody should have a health insurance coverage. Now, there are a few exemptions of people who won't have to have health insurance coverage, and these are people who qualify and file for a hardship exemption. So maybe you don't want health insurance coverage for religious reasons, or if you're a member of a federally recognized tribe, you don't have to have health insurance coverage. But for the vast majority of Americans, you have to be enrolled in a health plan by March 31st, 2014. So basically, you have from now until March 31st, 2014 to enroll in a health insurance plan. And how the penalty works is that at the end of March is which ends the open enrollment period. So you don't have the ability to enroll into a plan after March 31st unless you have some kind of what's called a life event. So maybe you're covered now under a job, but you lose your job in June, and so you need health insurance coverage. You will be allowed to enroll. But everybody else, they won't get that special exemption. They should have coverage by the 31st. So when you do your taxes at the end of the year, really in January 2015, is when you have to show proof of health insurance. And if you don't have proof of health insurance, you have to pay the penalty for being uninsured. It's called a shared responsibility penalty, which is $95 or 1% of your income, whichever is greater. That is a shared responsibility penalty. And if you have children in your household who are uninsured, the penalty for every child that's uninsured is $47.50 in year one. So that's a shared responsibility penalty. I'll take one more. Or I'll take both of these. Since you're here, I'll take both of them.
My question is, it's a little confusing when I went on the site and saw the different things on what states accepted the Medicaid expansion and what's not. And so, like, I live in Pennsylvania.
Yes.
So you're talking about, the prices and the tax credit and everything like that. Mm-hmm. Essentially, if I'm enrolling, if I go in, is this from a private insurer in my own state that I have to deal with? And then so if it's expensive, let's say it's like $200 something a month and I can't afford that, is that where that tax credit comes in to help me pay that private insurer? Or is this something a completely different concept?
You got it almost 100% right. So how this works is when you go to healthcare.gov, you'll pick your state first of all. So you have to, insurance is locally managed generally by states, and so states regulate insurance differently. So you pick your state, and then you have to apply. So you have to fill out an application to apply to see what you're eligible for. Because some people that apply may be eligible for free health insurance in the Medicaid program, whether your state expanded or not, because there are some people right now who are eligible for Medicaid and never knew that they were eligible. and you'll find it out by going through the application process. At that same process that you apply for Medicaid, you'll also be screened to see if you're income eligible for the tax credits. And so you'll be told at the end of your application how much of a tax credit that you qualify for the year. So some people in the individual market are qualifying for $5,500 a year in tax credits, okay? And so when you pick your plan, let's say the plan is, $200 a month, you could qualify for a tax credit that could equal $150 a month. And so you pick that plan and you say, I want to buy this plan, and your credit is $150, so that means your portion to pay every 30 days is $50 a month, or maybe you want to pay it quarterly or pay the whole year. It depends on the insurance plan. They'll make that decision. But that credit is automatically sent directly to the insurance company on your behalf. So it doesn't come to you. Right. It goes right to the insurance company. You just have to pay your portion of the premium.
So just a quick follow-up of that. So if it's the whole year or whatever, and you actually still sign up via the website, and simultaneously it'll tell you, hey, pay your portion, and then you guys.
Yeah, so your insurance company, so when you pick a plan online, when you click enroll into a plan, and you enroll into a plan, that insurance plan will send you a message and then say, we have a way for you to pay online, or maybe you need to mail a check, or maybe you need to give us an account number of some sort. They'll basically give you what their way they accept payment. Okay. And then they'll ask you to make that payment by December 15th in order for your coverage to be effective beginning January 1. Okay. So you make the payment, whatever that amount, if it's $50, and then the IRS will send that other $150 right to the insurance plan on your behalf. Okay. So that's the way it works. Okay. Thank you. Last question here.
This is a very quick question, and I also just want to thank you for being here because I definitely learned a lot. I just wanted to know about how the Affordable Health Care Act can help people personalize their health care plans. I'm a singer, and so I go to annual checkups to my otolaryngologist. Most people don't do that, right? My health care insurance at the moment won't cover that. Mm-hmm. And so I was just wondering, is there anything in the Affordable Care Act that helps people to personalize and specialize what they need?
Right. That's a great question. So simply speaking, all plans will come with a set of essential health benefits, and this is what the vast majority of all people use in health insurance regularly. So hospitalization, maternity care, prescription drugs, et cetera. But there are plans in the marketplace that cover more robust services like the ones that you talked about. And they're in the marketplace, and what you have to do is when you're comparison shopping, it's kind of like anything else. If you were buying a car, some people want heated leather seats in their car, but a lot of other people don't need heated leather seats because they live in Florida, and there's no reason why they would want to heat up any kind of seat in the car because it's 90 degrees outside. But for you, it may be very important. So what you have to do is you look at the sticker on that car to see what's included in that. And so when shopping for a plan, those are the same things that you look for in a plan. So you will have the ability to be able to contact that plan and say, hey, I have this special service, this provider provides these services for me. I want to make sure this plan covers it before I purchase it. You'll be able to answer that question. But we don't tell insurers what to put in their plan. We set the floor, so there's a minimum level of services that all insurance plans have to cover, but there are plans that cover a lot more stuff, and they're in various metal levels. So you got bronze plans, you got silver plans, you got gold plans, and you got platinum plans. And I don't know why they found the record insignia to go platinum plans, but I'm happy that they did, because some people may want a platinum plan that would cover a larger, more robust services, no co-pays, none of those kind of things. And so you just have to look at each plan to see that. But I don't know if you can necessarily customize and pick these individual services. Some insurers may get to that point, but right now the plans are more robust on a scale going up.
Thank you.
You're welcome. Thank you very much.
All right, it's lunchtime. So thank you to all our panelists and our speakers this morning. And as you head off to lunch, we want to remind everyone of a few things. During lunch hour, there's a policy briefing in the networking space across the little walkway there, where Future Music Coalition is actually going to present a bit more from our artist health insurance survey. So you'll find out a bit more about that. Free Press will be there to talk about some media policy issues, and Prometheus Radio Project is going to talk about low-power FM rollout. And this, the breakouts start again at 2 o'clock. There's one in here and 2 over in the Student Center. And although we're not quite done with our time together, please take a moment to fill out an evaluation form sometime today. So we'll see you back here at 2 o'clock for more programming, and thank you again for your attention.